So I think the biggest thing is that after an amputation, there's obviously a lot more forces acting on that one leg, right? So now there's two parts to that. The first part is dogs that are using their other leg well have a much harder time with that, right? So if you have a dog that has a really painful cancer, is not using that leg, they have a much easier time adjusting to it because they're already used to walking on three legs. Now, if you have some form of other injury or a cancer that requires an amputation but hasn't caused a lot of pain and lameness, then that's a lot harder for them to adjust to that. Then the next part is strengthening of the muscles in the limb that is remaining, or so that we can try to make sure that that limb is prepared for that. But after surgery, I think that is a really important part too. So seeing a certified rehabilitation practitioner for that, everybody has their own program for that, but I do think that is a lifelong commitment. And the other part is there is a lot of forces that are acting on the joints now. Okay, so we anticipate that there could be some joint problems. Now, what can we do to prevent joint problems? The number one thing is probably adequate weight, right? So to me, a tripod should be a body conditioning score of somewhat 4.5 out of 9. That is a scale that's available from Purina. There's different scales, but that is something that you can see online. You palpate your dog's ribs, see how much coverage there is, and your veterinarian can help you with that too. So weight makes a really huge difference for dogs developing osteoarthritis. When I see a dog that's on three legs and is overweight, it makes me cringe because I know that down the road that's gonna have a big impact, okay? So that's probably the number one thing. So the second thing would be some form of omega-3 fatty acids. So that's fish oil. Now when we say fish oil, that is a broad category, and there are different types of fish oil. So the ratio is important, so there's different types. EPA and DHA are the ones that have been shown in the research to be beneficial for joint disease. We actually don't know how much it does to prevent things, but we do know that it helps for dogs with arthritis. But your veterinarian can help you out with figuring out what's the right dose. There are diets that contain fish oils. That's one option. And then the other option is to supplement them. So then we get into the next benign thing, which would be glucosamine, chondroitin sulfate. So lots of different products out there. Probably the important thing about that is that there are some products that you can buy, obviously, at big stores, and we don't really know how much they contain. There was a study done that looked at that, and there was a lot of variation in what was actually on the label and what was actually then in the products. And so those are the things I would highly encourage. Now, then as far as how much rehabilitation should these guys get, if you can work with someone that gives you home exercises for strengthening, that's probably the ideal thing, right? There are so many things we can do for these guys just to have enough core strength and all that. Those would be probably the four things that I would highly encourage. Yeah, real brief. So the four things, the first one is weight control or weight management. A dog like him, in perfect body condition, you just have to maintain it, right? Then the second thing is omega-3 fatty acids, so fish oil. And then the third thing would be glucosamine, chondroitin sulfate. And then the fourth thing would be rehabilitation, physical therapy, whatever you want to call it, but basically strengthening of the muscles and maintaining what we have left in the other three legs.